Today's date is the 26th of January, 2019. We're here with Susan, who is a family physician from Michigan, and she's here for our workshop. Susan, comments on the workshop?
It was amazing. It's even through the jet lag, it's so hard to not be watching every minute, and I would recommend it to everybody. It's been, the last 2 days felt like a week. It's quite amazing.
Worth the money?
Absolutely.
You would recommend it to others?
I would recommend it to others, and I'm thinking of doing it again just to catch up.
We have a lot of people coming back again.
Okay.
And it's because it's for a tune-up, for the new advances and everything else. So you're welcome. That's an honor that you want to come back.
Thank you. Actually, I'm thinking of bringing one of the ladies too that does the IVs for me, because there's a lot of information. Good.
And the techniques that you learn.
Oh, are amazing. Especially some of the IM injections.
The particular ozone injections, the
Yes.
joint injections,
Yes.
and things like that. Thank you. May I post this on YouTube?
Yes.
Thank you very much. I appreciate it. Good.
You make the technique look so easy. So, it's amazing.
Today's date is January 26, 2019. This is Dr. Alden Williams from Texas. He is a board-certified anesthesiologist and pain specialist. So we were really honored to have him here at our quarterly workshop for Ozone. Alden, you're a specialist, highly respected, extremely highly trained, and you've already been doing ozone therapy. What are your comments on the workshop this weekend?
Well, first of all, I'd like to say I'm actually the one that's being honored to be in the presence of, Dr. Robert Rowan and Dr. Howard Robbins. I did DIV ozone therapy with Dr. Robbins about 1.5 years ago. And before that, for the last 3 to 4 years, I've been doing intraspinal ozone injection and also periganglionic injection, just like they've been doing in Italy and in Europe for over 40 years. They've probably done over 50,000 cases, in certain areas with tremendous success for intraspinal and intradiscal ozone. So I got into the ozone world from a spinal perspective, and then once I started doing the intravenous ozone, it actually blew my mind as far as the results I've been getting and the kind of medicine I've been practicing for 23 years. So for 23 years of practicing conventional medicine, and I've been pretty much conventional, using steroid injections and anesthetic and radio frequency rhizotomies to do destructive procedures.
Destructive.
Which, I thought that was the way to go. But when I got introduced to ozone, when you do ozone therapy, it is just the amazing results that kind of baffles the mind in how this has been a forgotten, or not even a forgotten, an undiscovered therapy.
And ignored.
In the United States.
Ignored.
So my response to how the workshop has been, it has been fabulous. It has been probably the best CME, which I probably will not get any credit from my specialty for being here. But this CME that I've gotten with Dr. Rowan has been incredible. The teaching has been superb. The response that he has to the students, and I consider myself a student of ozone because by no means I'm an expert, because that's why I'm here, to be taught by the world's best ozone therapists. So as a conventional guy that I've done a lot of spinal injection under fluoroscopy, under x-rays, under CAT scan, it is quite shocking to see the results that he has been getting without imaging studies. Now, that's not to say I'm going to be doing it without imaging studies, because I still think imaging is the king. But when you don't have it and you don't have access to it, his technique that he teaches, from my perspective, knowing what I see when I do injection under imaging, is excellent. The way that he does the knee joint injections by palpation and then injecting and feeling the gas on the opposite side of the knee is an excellent method. Now, I would not recommend, if you were going to inject other substance like PRP and umbilical cells, which is very expensive, you should probably do that under imaging, because you want to make sure you're 100% in that joint. But the technique that when you're injecting a gas and you can palpate and do it, I see no issues at all as far as his ability to get into a knee joint and feel the technique that he does. So it's been a very, great experience. I saw hip injection, shoulder injections. I had him do my sacral hiatus. And as an anesthesiologist, he did my caudal injection from the sacral hiatus approach. And it was done with local anesthetic, and it was done smoothly. And trust me, I've done a lot of sacral hiatus injection and caudal lysis of adhesion. So it was really remarkable. And that's the first time anyone has ever put a needle in my spine, ever. And it was very, very good. So this workshop has been fabulous. I would recommend this highly. And I was actually very pleased to see another PMNR, pain management specialist trained here, because when I've been to Aruba at the Ozone Without Borders, there were no pain specialists there, no pain doctors are there. And it's sad because when I talk to my colleagues, when patients go and tell their other doctors what I've been doing, they look at them like they're like Martians with 4 heads and 9 eyeballs. Like, you had them do what? So the results of these treatments and the future of Ozone, I'm hoping that I can contribute to the long-term future of it. I'm going to try to get more and more involved, as much as these guys will let me hang around them and pick their brains, and I'm sure they want to pick my brains for what I do.
Was it worth the cost? Absolutely.
And I was skeptical about coming for the first day, because the first day was Ozone. And I was a little skeptical because I'm an interventional anesthesiologist, and I do injections in every single part of the body.
Right.
I've been in every joint, every tendon, every spot that you can possibly imagine. When he does TMJ injections, fantastic approach. Shoulder, hips, knees, ankles, spinal. He does some paravertebral injection where he injects ozone into the facet region. I'm not going to say the facet joint because he's in the region of the facets. The technique is fantastic because the ozone actually spreads. And when I've done the ozone injection using using fluoroscopy, I can see the spread along the paravertebral muscles and along the facets, that it spreads very easily. So I can actually imagine when he's doing it with that technique that I know he's getting a spread. So you're going to infiltrate the area, and you're going to get some results, with reducing inflammation and circulation in the area. So it's a fantastic approach.
How's the food?
Fabulous. I actually turned part vegan, for the new year, so I can lose some weight. And the food has been fantastic. His wife is wonderful.
Thank you. May I post this on YouTube?
Absolutely.
Thank you. And for the viewer, this is Alden Williams. What city are you in?
I'm in 2 cities. I'm in San Antonio and Bernie, and I have a website, Apple S Sam P Peter M .doctor.com. Advanced Spinal Pain Management Doctor.com. ASPM.doctor.com.
I want the viewer to know that I am honored that you came. You're a pain specialist, ozone using, and you really got a lot out of this. So that's an honor to me, number one. Number two, I want the viewer to know that yes, I have failures, as everybody does, and I am so delighted to have met you, an anesthesiologist who can use radiographic techniques, fluoroscopy for directed needle injection, and you can inject discs. That's one thing I can't do. I have no power to do that, and I do have patients who need that. And I'm ecstatic to know you, because now I have a place I can refer patients.
I'm looking forward to it.
And an ozone-using doctor who's very comfortable with it. So thank you so much for being here.
You're very welcome. It was my pleasure.
Date is the 26th of January. We're at the end of our workshop. And this is...
Dr. Kathy Allergen. I am from New York. I also practice in Westchester with the Blum Center for Health.
And you are a board certified...
So I'm double boarded. So I'm board certified in physical medicine and rehab, and also interventional pain management.
Pain specialist. Would you comment on this weekend's workshop?
So I came here, this is my first exposure to ozone as a pain interventionalist and someone who really cares about quality of life and treating pain in ways that have nothing to do with opiates, and wanting people to actually do better. And so with this treatment, this is the reason why I'm actually here from the Blum Center. And it's been an amazing opportunity to actually see what's happening. We've seen patients firsthand that have gotten better. We've had experience from people who've actually done training here and have come back or have sent other staff members. And so we're hearing about the results. And I think the most impressive part of this course this weekend was really hearing that the people who've been doing this for over 20 years still actively think, how can I do it better? And when I walk away from here, I'm essentially an ambassador for my group to say yay or nay about moving forward with Ozone and as an endeavor. And I can say where I got trained, they're critically thinking about the equipment that they're using, how they're using it, how patients are getting better. And I've been quite impressed. And they're just such wonderful people. And the message is, let's get people better. And that makes me quite excited.
Was it worth the money coming?
It was worth the money and the time, absolutely.
That's nice to hear. And it's an honor for me that you, a pain specialist, will come and you will be using these techniques, yes?
Yes, and I hope that, you know, to also do more research and to bring outcome measures. And I think that having more data and more data and more data over time, that things will change.
Our goal, you know, Dr. Robbins was here too. Our world is to see the world open up to ozone therapy. I believe we can end the opiate crisis, the NSAID injury epidemic, among other things. And I think with what you saw here, the results, you can see that's possible. Is that correct?
Oh, absolutely. Absolutely. And I think more young physicians can be trained in these methods. I think there's a lot of opportunities to actually treat people in different ways without harming them.
You would recommend this to other doctors?
Absolutely.
Thank you. May I post this on YouTube?
Yes, you may.
Thank you very much. 6th of January, 2019. This is Becky, who is the registered nurse of Dr. Williams, the pain specialist. And you came to be trained on ozone. What were your thoughts on your training today?
It was wonderful. It was great. A lot of information. Good information.
It was worth coming?
Oh, definitely.
Quality of the training?
Oh, beautiful.
Would you recommend this to other office
definitely.
nurses?
Definitely.
Were you surprised at what you saw and heard in terms of results? And
oh, yes, yes. Everybody raves about it, and I can't wait to take it back to my office and introduce it to our patients.
Good, thank you. May I post this on YouTube?
Yes, you may.
And I think you're working with one of the finest guys out there. I'm so honored that Dr. Williams came here.
Thank you. He sure is.
It's the 26th of January, the end of our ozone workshop with Marjorie Livingston and baby.
Yeah.
29 weeks pregnant, who went out of her way, considering her condition, to come here for our workshop. You're a nurse practitioner. I wanted to ask you what your comments were on our workshop, the quality, what you learned, and everything else.
It was great. Well worth my time coming out here and the money. And I say that really just from personal reasons. I have family members who need this. We've been doing DIV, but they need to get better faster. And we've known, I mean, even Howard, I did training with him, and he said, when you do your training with Tempest, not if, and I looked at him like crazy, you know, you're crazy, but it's true.
It's true that you had to come and do Tempest.
It's true. Like, we're looking, you know, we got about 70% and, you know, better. But we need to do Tempest. And so we wanted to. And so 10 days ago, it all came together. And we're very grateful because it's going to make a huge difference. And the ozone injections, the joint injections, the Prolozone, that's just very exciting for me as well. A lot of family members are always asking me to, can you shoot my joints with ozone? And now I can say, yes, I can. So that's exciting.
And you would recommend this to others?
I would. It's excellent. It really is. It's very hands-on, which is great. And you also learn, it's really cool because people come from different fields. You see how they integrate ozone into their practice. It's just, you just learn a lot. And just from talking to people and listening, and like tonight we learned about, UV and how it works with ozone. I mean, it's just wonderful. Very enriching, wonderful. It's just awesome.
And you would recommend it to other docs?
Definitely.
Okay, thank you. May I post this on YouTube?
Sure.
Thank you very much.
Okay.